As dairy goat producers, herd health is integral for profitability, so a productive and a respectful relationship with your veterinarian is paramount for good health and the herd and thus profitability. So it begs the question, what can I do or what can we do to nurture a productive, professional relationship with our veterinarian? So in this module, we'll discuss tips to improve that vet-client relationship, all with the purpose of increasing client satisfaction to enhance the efficiency of that vet-client teamwork. So research shows that the ability to communicate effectively leads to better clinical outcomes, such as clinical satisfaction during the veterinary visit and also increased client compliance with the veterinarian's recommendation. Both would seem very important. So utilizing SMART goals can help you and your veterinarian to focus on areas of concern and utilize more time more efficiently during the visits. So having a clear end goal in mind will help to maintain focus when addressing problems. So do not forget to ask questions. There are two different ways that questions can support your relationship with your veterinarian. First of all, they can help provide solutions to concerns or challenges that your herd faces. And secondly, they can clarify interactions or communication from your veterinarian that you don't understand or maybe not agree with. So creating a list of questions for your vet, and better yet, maybe even emailing them that list before your appointment, is a great way to keep vet visits on track, to be able to share those concerns with your vet and allow them time to actually prepare to address those concerns with you. So vets always seem to be doing research to find the best ways to address situations, and some that might actually be new to them. So even seasoned small ruminant veterinarians tend to look things up. So by sending questions ahead of time, you can provide your veterinarian the chance to be more prepared for your visit, which hopefully will result in more efficiency on your farm while they're there. And then finally, do not wait until you have an emergency to contact your local vet. Many vets will not provide after-hour emergency services to non-clients. And also keep in mind that your vet will be more helpful during an emergency situation if they already have an understanding of your facility, your goals, and the particular challenges that your herd faces. So the best way to establish yourself as a client for your chosen vet is to schedule a site visit where they can come to your farm, get a tour of the facility, discuss your particular goals and needs from them. And if you want to learn how to improve your skills in animal health related area, like managing difficult kiddings or bandaging wounds, for example, this might be a great time to discuss these goals and how your veterinarian can help you to achieve them. So expect this initial visit to take at least an hour and that your vet will charge you for their time and their travel to your facility. But this is an investment in your herd and it opens up a world of possibilities for improving animal health on your farm. So a SMART goal, just real quickly, is specific such as freeing the herd from a certain disease or reducing your somatic cell count to under 400,000. It is measurable in that percent numeric improvement as it's calculated. It's also achievable within the industry standards. So it's relevant to the improved herd health and profitability, and it's also time-bound to try to get this measure done by the end of the year time frame or by kidding season, for example. So when you do need to call your vet about a sick animal, you can start the visit off the right foot by providing them with just some basic observations. So you might want to describe the problem. He's just off today, doc. He didn't run up to eat like he usually does or she usually does. He's distancing herself from the rest of the herd. So be prepared to answer some basic questions like, what's their temperature? Did you take their temperature? Are they eating, drinking, urinating, defecating? When was the last time you felt they were normal? And have you tried any other types of treatments already? So the key to giving your vet the best chance of helping your animals is to notify them of the problem early. So letting your vet know when you first notice an issue is ideal. Even if you want to try to manage it yourself and maybe you're not even ready for them to come out, they may be able to provide you with suggestions over the phone and can give you specific criteria that indicate, it's time for a visit from the doc. They can also help avoid costly after hours and emergency fees as well. So if you notice a problem, let the vet know, even if you don't think it warrants an immediate visit. So even with the best veterinary care, sometimes we know in life things go wrong. A prized animal might die, a new idea that doesn't work out, or any number of other problems that farms routinely face. So in these situations, they can definitely be frustrating. So when it happens, we can turn them into growth and hopefully learning opportunities for producers and veterinarians both by maintaining respectful communication tactics and remembering that we're all on the same team here. The ultimate goal is the animal health and productivity. So how veterinarians and their clients communicate frustrations or sometimes the difficult news regarding such things as maybe you have a chronic or a terminal illness, so you might have a treatment or a treatment failure, unexpected outcomes during a surgery, you might have emergency cases, euthanasia discussions, and other potential medical situations that can have longer-term bearings on the relationship. It's important to remember that veterinarians are not miracle workers. They're doing the best they can. So while it is assumed that the veterinary did what they could with their knowledge and with their tool base, client frustrations are real at times. And so when they are less than ideal happens, using open-ended questions, so what now, doc? Or some nonverbal skills, maybe even try to share a smile while sharing a tough thought, not an easy thing to do. Other relational strategies, I respect that option, but I'm just wondering if we did this alternative treatment, what do you think? Or developing rapport and empathy, like, I know you must feel as bad as I do about the doe and what happened here. Or sharing your own experience, the last time that I went through something like this happened. Respecting the autonomy of the other, I hired you, doc, to make your best judgment. That's what you did. And avoiding implications of guilt, you were just trying to do your job the best you could. So these relationship strategies can both go a long way for strengthening for the vet-client relationships on both sides. So most vets will charge based on a combination of time, including travel time, plus their mileage and materials or supplies for farm calls. So making the vet visit as efficient as possible, like having the animals to be looked at already penned up beforehand, so the vet doesn't have to be involved in a rodeo roundup. So having extra help on hand during the visit can also help. Vets have their schedules too, and just adding a list of things to be done unexpectedly might not be in it for the day. So not being prepared or adding last-minute services might cause the vet to be kind of shortchanged in their time or even their information flow for the vet or the client. So asking for help identifying resources to more basic questions can be useful in the future without having the need to call their office. So it's common for producers to cringe at the cost of veterinary services because the value of the mature doe may often be less than the cost of a vet visit to actually treat that doe. So while the vet may be crunched for time, the client might try to hurry the vet along to cut down on the hourly rate charge, refraining from asking questions or not even receiving full advice on the treatment options. But the bottom line, the vet or the client might shortchange this relationship to the detriment of the animal, the herd, or even the farm profitability. So your relationship with your veterinarian is an investment in your farm. Producers should build that veterinary cost into their annual budgets and expect at least one walkthrough visit per year just to maintain your official vet-client-patient relationship, and use historical data to estimate the number of times you might have a sick or an emergency call based on that historical data. So actions that can compromise a healthy, productive vet-client relationship usually stem from a lack of communication and possibly trust. So if you have questions or disagree with the recommendations, don't be afraid to ask questions and explain your concerns, but again, do it in a respectful manner. And also remember that judicious use of antibiotics and other drugs is of utmost importance because inappropriate use could actually cause your veterinary license to be at stake and might result in drug residues entering the human food chain supply. So again, this module identified hopefully a gap in the communication skills of the outcome of the effective client-veterinary communication. So for animals, the effective communication between their owners and the veterinarians will allow better medical care in terms of drug route, dose, and frequency, and the animal health check. So better home routine care such as diet, exercise, and wound care, and consequently an increase in the overall quality of life of that animal. So effective communication can allow veterinarians to properly care for animals and avoid unnecessary stress, fostering a more positive working environment and enhancing the effectiveness and the efficiency of teamwork between the vet and the client. So for further study about vet-client communication, please search this research project like I did from the Veterinary Research Journal, an integrated review of the role of communication in vet-client clinical practice. So thanks for watching. Again, this is Larry Tranel, Dairy Field Specialist with Iowa State University Extension and Outreach.